Right. Hey, good afternoon, everyone. I'm Dr. Shah. I am the Medical Director of General Pediatrics here at Montvale, part of VMG. It's my pleasure to talk to you this afternoon about some of the common illnesses we see in children at this time of the year. Let's see. So I'll jump right in and I'll leave some time for questions towards the end. The main objectives of my presentation today is for us to recognize some of the common respiratory illnesses that we see in children at this time of year, and also to discuss some of the prevention strategies around it, because recognition would kind of is key, and then taking the next steps from there. So why are illnesses so common at this time of the year? Now, the kids are spending way more time indoors, given how the weather is outside, and given that we've been just trying to get ourselves in a little bit of a thaw from this icy Arctic blast. Kids are spending way more time indoors, and then that's how the germs spread very easily in the closed spaces. Also, the cold, dry air irritates the airways, making them more susceptible to these viral viruses that could penetrate and irritate the mucosa. Also, with kids, their immune system is still developing, depending upon the age of the child, of course. So in the first few years of life, the kids tend to get sick more frequently because they're still developing their immune library, if you will, against all these different viruses that are out there. So I'll touch upon some of the common illnesses that we see. The first one is common cold, also called the upper respiratory tract infection. It's caused by a whole host of different viruses, but we just kind of sort of lump them, group them together there. The other one I'll talk about is flu. Then there is RSV, COVID-19. We do see a whole fair amount of stomach bugs, stomach viruses at this time of the year as well, and briefly talk a little bit about ear infections. So the common cold or upper respiratory tract infection, the symptoms, as you all might be all aware, is a runny nose, stuffy nose, sneezing. They can have a cough, and usually the cough is because of the postnasal drip. All the mucus is dripping down from and the nose tickling their back of their throat, irritating their throat, causing them to cough. And at times they can have a low-grade fever. Typically, fevers don't worry us as such because it's just a sign that the body is fighting some type of an infection. Different viruses that could cause it. Some of the examples are rhinoenterovirus, human metapneumovirus, adenovirus, parainfluenza virus, a whole bunch of them. Keeping in mind each of these viruses has their own nuance. For example, rhinoenterovirus and human metapneumovirus in kids who have asthma can start flaring up and triggering their asthma. Adenovirus sometimes causes a lot of conjunctivitis, symptoms of conjunctivitis in addition to all the URI symptoms. So each virus has a little bit of a nuance. Parainfluenza virus can cause a croupy cough. So you might see some of these variations if your child is exhibiting runny nose, cold, congestion. This care or treatment for this is all supportive. Plenty of fluids, rest, using the saline nasal spray. That is usually my go-to, and I highly, highly recommend that. Using it multiple times a day even, because that really helps with the clearing of the mucosa from the nose. Use of a humidifier also helps because the air in general at this time of the year is very, very dry. And then to add to it, you have the heater on, which makes the air even more dry. So having a humidifier in general helps. The second big category of infections is the flu vaccine or influenza. Keeping in mind, this is a little different. This is not the same as para-influenza, which I spoke about a few minutes ago. Para-influenza tends to cross flu can as well, but influenza is you're talking about flu A and flu B. These viruses are notorious for causing, this particular group of viruses notorious for causing very high fevers, body ache, fatigue, headache, cough. At times it can be associated with a sore throat. Sometimes they have some GI symptoms associated with it too. We're currently seeing a huge uptick in the cases of the influenza A type of virus. So in case your child is exhibiting these type of symptoms, would recommend getting them tested, or if there is a history that they've been exposed to flu, starting empiric treatment with Tamiflu. So now Tamiflu doesn't exactly treat or cure the influenza virus. What it does is it halts the viral replication. So that decreases the duration of illness, So that's why giving this medication in the first 1 or 2 days of the onset of symptoms is going to be way more effective. Uh, Flu can be very serious in kids. We have had some very not pleasant outcomes. Kids can get pneumonia, can get meningitis. They can get very, very sick with influenza. Most of the kids, they recover just fine, but there are some cases that we have come across where they get into a lot of respiratory trouble. Flu vaccine is still the best prevention. Depending upon the year, the flu vaccine has great effective efficacies, not so great at the other times, but it is still imperative you get your flu vaccine every single year. The other virus commonly causing infections is the RSV virus. Now, who is most at risk is our infants, our babies, our infants under the age of 1 and premature babies. And of course, other children who have underlying conditions, chronic heart disease, chronic lung disease. The way RSV virus works, or RSV is really notorious for causing excessive mucus production. So hence it makes sense that these premature babies or infants who are younger than 1 year end up getting into more trouble because they have a hard time clearing their airways and removing all of this mucus in their secretions. Some babies may have some wheezing associated with it. And in fact, it's said that 50% of the babies who have wheezing associated with RSV may develop asthma in the future. The symptoms would be difficulty breathing, fast breathing. They're not able to feed, again, as the symptoms say, because they have their nose is blocked and they're trying to feed through their mouth. And infants are obligatory nose breathers. So it's very difficult. So they will just refuse or push the bottle out. RSV can get very severe very quickly. Typically, day 3 to 5 of illness is when the illness is the worst. It's at its peak. Supportive care, again, for this frequent nasal clearing, suctioning as much as possible using the humidifier, and keeping a very close eye on the baby in terms of how they're breathing. What I mean by how they're breathing is looking at their little nostrils. If their little nostrils are going in and out, they're flaring, that's a sign that they're working really hard to get air into their lungs to be able to get oxygen. Or if you see them using their belly muscles to breathe, or their lungs are going in and out to the point where you can see the rib cage. All of these signs are concerning because it tells us, the baby's telling us that they're having a hard time getting air in. So all of these conditions would require immediate medical attention. Speaking of which, RSV is also very contagious. Older kids, when they do get RSV, it's more like a common cold, but you would see these children having fevers and having this runny nose congestion for a long time. We do have some protective mechanisms available for the RSV virus. There is a vaccine which is available for pregnant moms to take to protect their unborn infant, and also for individuals who are 65 years of age and older. For our pediatric patients, for our babies, our infants whose mothers have not received the RSV vaccine, we can give them an RSV immunoglobulin called as nirsevimab, or Beyfortus is the common trade name you might have heard of. What this does is it is straight up immunity. It's an immunoglobulin which you give the baby in case that they were to be exposed to this virus. They have some immunity to fight it off. I'm not saying that they will never get the RSV infection. However, even if they were to get it, the intensity of the infection will be very low. And we have seen great reports recently where we've been able to keep these babies outside of the emergency rooms, outside of the hospital and the ICUs. Moving along, changing tracks a little bit, stomach virus. This is also very typical, usually norovirus, rotavirus. It can be bacteria causing these symptoms, but most of the time it's a viral infection. The symptoms, as the name suggests, kiddos might have vomiting, diarrhea, crampy abdominal pain, usually around their umbilicus. They can have a low-grade fever, which is, again, a sign that the body is fighting off an infection. Treatment for this is, again, supportive, where you give them small sips of water more frequently. The key out here is giving small sips of fluid, because the moment they take a very large amount, it irritates their stomach and it'll trigger them to have vomiting. Our fluid of preference would be an oral rehydration solution, something like Pedialyte. The reason being, when you're vomiting or having diarrhea, not only are you losing fluids from your body, but you're also losing electrolytes from your body. And the other recommendation is to avoid sugary drinks like Gatorade, juice, things like that, because sugar in these beverages can cause an osmotic diarrhea, meaning it can worsen the symptoms of diarrhea. So avoid sugary drinks. Plain water, oral rehydration solutions, or soups, things like that. So the other question is, when do you keep your kids at home? Because obviously you don't want to try and limit the spread. You want to try and limit the spread of this infection. You don't want other kids to get sick. So the key recommendation, and you might have seen this across the board through all the schools, daycares, is that keep your child home if they're fever-free, as long as they're fever-free for 24 hours or more without the use of fever-reducing medication, meaning they cannot go to school if they've had a fever or if they've received Tylenol or ibuprofen in the 24 hours prior. The reason being, like I alluded to a little while ago, when you have a fever, it is a sign that your body's trying to fight off a type of an infection. So fever-free for 24 hours without the use of fever-reducing medication, and then they can go back to their school or daycare. Of course, if they're vomiting or diarrhea, again, you want to keep them home because these bodily fluids are very contagious. If they have a cough, if they're tired, they're not going to be able to participate in the activities. And if they have some particular types of contagious rashes. Now, going with the rash, there are a few in between, like impetigo, when you have like a bacterial rash on the face, things like that, because that can spread, the infection can spread from one child to the other. Reasons to call your pediatrician or your primary care provider is if this child has had a fever for more than 3 days. Now, again, I'm not talking about infants out here. I'm talking about older kiddos who are completely vaccinated. We expect to have some sort of an immunity. And the reason we say about 2 to 3 days is because that's typically how long viral illnesses last. Now, if it's going beyond that time frame, we want to make sure we evaluate the child to see, is there something else going on? Is there a secondary bacterial infection? Is there some other source of infection that requires medical attention and treatment? If the child has any sort of trouble breathing, no matter the age, when I say trouble breathing, things that you're looking for is, again, nasal flaring, little nostrils going in and out, using their chest muscles to breathe, belly muscles to breathe. Or for older kids, they're unable to speak in complete sentences. By the time they're able to get their words out, they're panting and huffing, and which is not normal. So if they're getting out of breath very easily. If you're seeing any signs of dehydration meaning they haven't peed in maybe 6 hours, 8 hours, depending again. For older kids, they can go longer without peeing, but for the younger ones, so you know your child's baseline, and if it's gone an hour or two since, longer than their usual baseline, you know, you want to start thinking about how much fluids are they taking? Are they losing fluids from other sources? Because if you have congestion, if you have vomiting, you have diarrhea, you have a fever, your body is already losing out fluid. On top of that, they're not consuming enough liquids, is going to get them dehydrated. So keeping an eye on the urine output, on the amount of PP diapers or the number of times they're using the bathroom, the color of the urine is very, very important when they're sick. Also, in case your child is not acting like themselves, like they're just being very clingy or very cranky or just wanting to lay down on the couch at all times, which is not usually their typical behavior. Again, you want to keep your, you want to be a little bit more alert about this. And for infants, for younger infants, younger than 3 years, 3 months of age, you want to be more mindful, be more in contact with your pediatrician, because these little ones can get more sick very easily. And especially if your child has not received their vaccines as per the AAP recommendations by the age of the infant, then you need to be even more careful, because now the infant is going to be at a very high risk for getting other preventable infections. So how would you prevent some of these winter illnesses? Key prevention would be hand washing as much as possible. Best is with soap and water, but if soap and water is not available, using hand sanitizer. Keeping up to date with the vaccinations, with the immunizations based upon the age of the child and the recommendation for the AAP. Getting good sleep and nutrition, that definitely helps with supporting the immune system, which eventually prevents kiddos from getting sick, or even if they get sick, they recover a little bit faster. Teaching our children to cover their cough and sneeze, and trying to clean high-touch surfaces as much as possible. High-touch surfaces, you want to try thinking of the doorknobs and the handles and your kitchen counters and places where there's constant activity in your house. Some ways to support the immune system is enforcing healthy habits through the year at all times. So it just becomes second nature, where the kiddos are having a balanced diet. You have your carbs, you have your fiber, you have all big food groups, your protein, all of that is a part of their diet, that they're getting adequate sleep. Physical activity is also key. The kids do need to have at least 1 hour or 60 minutes of movement structured or built into their day. It doesn't need to be 60 minutes at a time, but even if it's broken up, but you want your kids to be active for at least an hour a day. And for the older kiddos, trying to manage stress, with tests and homework and all the other activities and all the other stressors that might come through their way, sort of trying to, assist the child to manage and best navigate through that system. Some myths and facts: cold weather doesn't cause illness. It's the germs that cause illness. And in the cold weather, we're all inside. So hence we tend to get sick way more in the wintertime than not. Antibiotics do not fix viral infections. Antibiotics treat only bacterial infections. And usually bacterial infections manifest in a slightly different way. Some of the prevention strategies, again, similar to what I just spoke to a little while ago, a lot of hand washing and sanitizing, wearing a mask when ill, because that just sort of is a physical barrier with spreading of the germs, avoiding crowded indoor areas as much as possible, especially if you're high risk or if you have an infant who is younger, then sort of, making those mindful decisions, keeping up to date with your vaccines and cleaning the high-touch surfaces. This would be the reasons why you would seek immediate medical help. Color change, just absolutely lethargic, no urine, and having difficulty breathing. And some tips to take care of the child at home: a lot of comfort measures, monitoring their symptoms, keeping an eye on the fever curve. Also making sure that you have the correct dose of their fever-reducing medication for acetaminophen or ibuprofen, because the correct dose is key, especially for the kids as they're gaining weight. If we're not dosing them adequately, it's not going to help bring their fever down, or it's not going to help with their pain as well. And with that, it ends my presentation. I did want to leave some time for questions.
Fantastic. We do have a few questions. Everybody listening, if you could send in your questions, now is a great time. Could you give us a few examples of, you mentioned comfort tips for when our kids aren't feeling great? What are a few of your favorite ones?
Screen time, as they choose. In terms of helping with hydration, ice chips are one of my favorites. Ice chips or Pedialyte popsicles, because not only will it get them some hydration, but it also cools them off, and kids are more likely to suck on ice chips versus constantly drinking a few sips of water.
Great. When should I worry about a fever being too high?
So the specific number of the fever is not as worrisome. We're actually happy that the child has a fever, because that means it tells us that the body is fighting off an infection. What I would be more worried about is not, is it a 101 fever or a 104 fever? Yes, that information is helpful. But what would be more worrisome to me is that the child is refusing to drink, has not peed in 6 hours plus, is just laying down. Those are more worrisome signs. The number of the temperature is not such a trigger.
That's good to know. What are your thoughts on holistic treatment options?
Again, I'm a practitioner of allopathic medicine, so all of that is out there. It works. However, I'm not an expert to comment on it one way or the other.
I've heard people talk negatively about Tamiflu. Why is that, and what do you think?
So the reason Tamiflu's got a bad rep is because it does have its own side effect profile. It it does not sometimes sit very well with the kid's stomach. It can cause them to have an upset tummy, vomiting, belly aches, irritation, and there is one of the side effects that is mentioned is change in behavior. My thoughts with that are, yes, those concerns are valid. Putting into, at that point in time, putting in the risks and weighing the risks and the benefits of the medication. If the child is having a 104 fever, it's within the first 24 to 36, max 48 hours of illness. I would err on the side of caution and start the Tamiflu because that has definitely shown to dramatically decrease the duration of illness. Because untreated flu infections can go on for about a week. You may have a fever for about a week and a cough for about a week. And then starting the Tamiflu at the 1 week mark makes no sense because now the virus has replicated and it's all over the body anyway. So then you putting the child through the side effects of the medication doesn't make sense. So again, weighing the risks and benefits and doing it with your provider at that time because it changes. There is a nuance to it in terms of starting the Tamiflu.
Great. Thank you so much. So it looks like that's all the questions